Hi everyone. Now we are going to discuss about non-communicable disease. First, introduction of non-communicable disease. Non-communicable disease account for a large and increasing burden of disease and worldwide. It currently estimated that the non-communicable disease approximately 60% of global death and 43% of global health burden. This is the projected to increasing to 73% of death and 60% of disease burden by 2020. The another factors are including in non-communicable disease conditions are hypertension, coronary heart disease, diabetes and stroke, malignancy, obesity, blindness, psychiatric and disorders. Then the global status of NCDs means non-communicable disease. Non-communicable disease are leading the killer today are on the increases. The cardiovascular disease, tobacco, and nearly 80% of these deaths occurred in low and middle income countries. NCDs are leading cause of death in the world and responsible for 63% of the 57 million deaths occurred in 2008. Then, the majority of these deaths, 36 million, were attributed to cardiovascular disease and diabetes, cancers, and respiratory disease. Chronic respiratory diseases and the NCDs are largely preventable by means of effective intervention. The tackle and shared risk of factors are tobacco use and unhealthy diet, physical inactivity, and harmful use of alcohols. Then the risk factors of non-communicable disease. First one is tobacco use are the main risk factors and alcohol consumption, raised blood pressure, obesity, diet and physical inactivity, diabetic mellitus, then high serum cholesterol. Obesity defined as a normal of excessive fat accumulation that presents as a risk to health. It is most prevalent form of malnutrition. It is common. It is one of the most significant contributors of ill health. The central factors distribution or abdominal fat distribution or android obesity, then more serious than gynoid fat distribution. Global status of obesity is growing problem across the global and worldwide. More than 300 million adults are obese according to WHO. Then the obesity is the second leading cause of preventable death and suppressed only by smoking. The body mass BMI is a simple and widely used method for estimating body fat mass. The BMI is calculated by dividing the subject's weights in kilogram by the squares of his or her height in meters. Then the another risk factor of common disease are diabetic mellitus. Diabetic mellitus is a chronic and metabolic disease characterized by elevated levels of blood glucose and which leads over time to serious damage to heart, blood vessels, the eye, kidneys and nerves. WHO classification means diabetic mellitus, insulin dependent diabetic mellitus, non-insulin dependent diabetic mellitus, malnutrition related diabetic mellitus. Other types means secondary or pancreatic disease, hormonal imbalance, drug induced or genetic disorders. Prevention and care of diabetes included primary, secondary and tertiary prevention. Two strategies of primary prevention. First one is population, then second one is high risk strategy. Population means maintain normal blood weight, diet control, and exercise. High risk strategies change in lifestyle, correction of overeating, and control of body weight. Then the secondary prevention means adequate treatment to reduce the blood glucose level and control the diet. Use of oral hypoglycemic drugs, use of insulin. The tertiary prevention means diabetic produce many complications like blindness, kidney failure, etc. The objective of tertiary care is organized specialized clinic called diabetic clinics. The cardiovascular disease, coronary heart disease or ischemic heart disease is defined as the impairment of heart function due to inadequate blood supply to the heart. The ischemic heart disease is clinically manifested as angina pectoris and acute myocardial infarction, sudden death and cardiac failure, arrhythmia. Hypertension. Hypertension is defined as a systolic pressure equal to or greater than 160 mmHg or diastolic pressure is equal to greater than 95 mm of Hg. The causes of hypertension include idiopathic hypertension, hypertension due to causes to unknown causes, and it is due to some disorders called secondary hypertension. The causes of secondary hypertension included renal disorder or endocrine disorder, pregnancy, etc. The risk factors of hypertension is increasing age, genetic factors, obesity, high salt intake, fatty diet, alcohol consumption, lack of physical activity, anxiety, stress or oral contraceptives, noise and handling of vibrating tools. Prevention of hypertension, consumption of less salt and restriction of unsaturated fat in the diet. Behavioral changes like avoid smoking and alcohol consumption, awareness of stress, health education, diet, weight reduction and exercises. Secondary prevention is early detection of cases and lower the blood pressure by the uses of drugs like actinol, etc. Thank you.